Hi, good night, guys. Just a reminder for the Mrcs exam. There are a few things that you have to keep in mind that they could ask you to do in terms of the procedures. For one, they can ask you to place something as simple as an IV access. For those who are like registrars and above, you probably don't put IV access too often for patients, so that's probably left to the intern or the SHO. So try to review or get a bit of help putting these IV access. My examination actually had a prosthetic arm. I think I mentioned this in one of my videos before, and this prosthetic arm was very difficult to get the flashback for the IV access, but just bearing that in mind. Another thing they could ask you is actually lump removal. The removal of lumps from a peripheral limb. You have to actually just remember that you have to clean, drape, the usual, make the elliptical incision, and then you have to suture. You could actually have to suture in the exam on a template or a fake skin prosthesis as well. And you also have to remember that there could be chest tube placement in the exam. Chest tube placement was in my exam, and you actually have to go through the most of the steps. You also have to identify the danger triangle, and that in itself is easy marks that you don't want to miss up on because you've probably didn't review it, thinking that it probably wouldn't come, but these things come. Interrupted stitching, that comes on the examination. Sometimes they can ask you that, and some persons that I know have actually gotten like CT angiograms on their exam. So learn to interpret radiographs with some level of competence. We know you're not, most of you probably won't be like neurosurgical residents or even cardiac residents, but still try to have some idea of how you would orient radiographs. Okay, those are the 4 things that I really wanted to mention to you straight off the bat. Okay, I'm going to try to do some videos on the anterior triangle as well as dental cements, and I may do a video on the bones of the face, and any other requests that you make, I'll try to take that into account. Okay.